I think what we forget today is in 20 years' time, we'll look back at today's healthcare as being in the dark ages. We'll be shocked that 10 to 20% of patients get treated by guidelines, that people still die of strokes and cancers, because we'll have made such a big progress, I think, with these diseases. Given the amount of work we have to do, I think we need all the help we can get.
We're here to talk about AI at the bedside, to bridge that gap of bringing sort of true data science and computation to the clinical frontier between patient and provider.
Right now, our keystone project is to develop a neuroprosthesis that allows people with paralysis to speak again. So we have an ongoing clinical trial to detect the neural activity as they try to speak. Then we use a lot of AI tools, in fact, many of them adapted from things like ASR, automated speech recognition, to actually decode those neural signals in real time. A man who had had ALS for about 5 years had these implants. We wait a few weeks for the skin to heal. We plug it in, we turn it on, and within a couple of hours, he was able to speak to his 4-year-old daughter with whom he had never had a conversation. Implanted electrodes from 20 years ago and modern AI have gotten us this far. There's a lot of companies making even better devices, so I think the future is extraordinarily bright for this type of approach to restore lost abilities.
When there's a disease that is going to disable you or kill you, it's pretty obvious to anyone in healthcare that you should be looked after by someone who really understands that particular disease. And that's what Viz does. We provide an AI safety net that detects the disease in a scan, a brain scan, or an EKG, or in the EMR, and routes that patient to the most qualified specialist in the health system. Clinical medicine needs to have tools that make sure that patients get as close as possible to guideline-directed care as they possibly can. And today, we're starting to see that coming to the fore.
Do you think there's a world in the, not sci-fi future in the next 5-10 years where we could replace doctors or providers in some way?
What I tend to do when I'm on cardiology call is I'll de-identify the patient case. I'll enter it into a model, and I'll prompt it to sort of get a sense of like how would the model kind of treat this patient in front of me? How would they think about the care plan or the differential, the next steps? I realize that it takes 2 hands to clap, that I have to go back and forth with this model to sort of prod it and to like torture it a little bit to sort of expand my thinking, but also get to the answer that makes the most sense. When we or our loved ones are very, very sick, we'll still want someone to sort of like orchestrate these models, to manage these models, but will they augment us? Will they force multiply the kind of impact that we can create? Absolutely.
The nurse is the steward of that patient for a shift, caring for that patient. I mean, literally touching and holding the hand. Do I think that AI is going to replace nurses? No. We're going to want that comfort. We're going to want that person that we trust. But gosh, don't we want that person to be supported with all of the information and none of the mind share taken away because of all the repetitive tasks that have to do with reimbursement and policies and all of these sorts of things, and really return them to true patient care? It's still very early days because there has been so few things that have been purpose-built for nurses.
What would it look like to redesign the system from the ground up?
The brain is an electric organ. The fundamental operations, like the units, the modules, are electrically recording and electrically stimulating. And if you can do that with enough flexibility of where and when, you can do a great deal of things. So we're already starting to see that with like deep brain stimulation being used for depression, OCD, anxiety. Like moving forward, one can imagine very capable platform technologies that would prevent or treat dozens or hundreds of neurological issues, kind of using the same hardware with just different software, to the point that maybe you don't even need to go see a doctor. It just sort of knows like, oh, you're developing this issue, we can intervene, do you want to do that?
I'm seeing so much innovation that's actually being led by health systems. I mean, they're just building AI and they're doing different things, and they have wonderful visions of completely wired rooms, hospital at home. So in some ways, I think they're going to pull technology vendors and innovators to where they see for what their local communities really need.
The first patient that I saw on my first day on the floors was this professor, and I was not prepared for the experience that I walked into, where she started to quiz me within seconds on whether or not she had multiple endocrine neoplasia type 2A or 2B. And that experience, I think, is going to become much more universal, sort of expected, because we've all got access to these tools. We're all going to be that much smarter about healthcare.
Wonderful. Well, I love the optimism of the panel. Thank you all so much. Thank you.